great to have you with us here on the John Fredericks Radio Network, Trucking the Truth, every day. Joining us now, I'm kind of excited about this because he knows a little bit about politics, plus about Virginia, plus about hospitals and HealthCare, transportation, many things. Joining us now, the president and CEO of the VHHA, the Virginia Hospital and Healthcare Association. He was also a supervisor in Prince William County. He ran for lieutenant governor. He was Secretary of Transportation under Governor Bob McDonnell, passing one of the biggest transportation bills ever. And by the way, now that I drive from my hometown of Chesapeake to Washington, D.C., and I get to take advantage of the new expanded I-64 going to Williamsburg, which cut my travel time by 30 minutes, and I see the rest of it is going to be expanded. Then I get into Fredericksburg, and I get to take advantage of the new Easy Pass lane that's been extended 15 miles, all a result of the Sean Connaughton, Bob McDonnell grand transportation compromise back in the day. So now I'm seeing it. See, now I'm seeing the benefits of it, right? Sometimes it takes a while to see the benefits, but now it's going there. So finally, roads improving in Virginia. But he's not here to talk about that. He's here to talk about healthcare and hospitals. And joining us now, Sean Connaughton. Sean, great to have you with us, man. Merry Christmas.
Hey, good morning, John. Merry Christmas. Hey, after listening to that introduction, I'm just going to sit here and listen to you. I'm not going to say anything.
Well, see, I was one of the only conservatives in America on the radio or any media that was in favor of the 2013 Bob McDonnell transportation plan that you were involved in, and all the Tea Party people were going nuts, and people said they would never listen to me again. But see, now they're driving on the roads. Yeah. And now they're getting from point A to point B, and it's cleaner, it's quicker, it's faster. They're not caught in the traffic. See, that's what tax dollars do if they're put to work the right way. Don't you agree?
Oh, yeah. No, and then this is why, after a lot of years where the state didn't put money into transportation, we're able to get a bipartisan compromise together to move forward on, funding all the transportation programs and actually putting it to use. And, we're very excited about the new governor in Richmond, Governor Ralph Northam. Of course, he's from your region, from down in the Hampton Roads area. And we're hoping, given a lot of things that he's talking about, we're hoping that we'll see a bipartisan solution moving forward on health care this year in Richmond.
Now, speaking of a bipartisan solution on health care, and of course we're talking to Sean Connaughton, who is the president and CEO of the Virginia Hospital and Healthcare Association, that acronym VHHA. Okay, Sean, so let's be honest with each other, right? Honesty is the best policy. So in the last couple of years, I was part of the media assault opposed to Medicaid expansion in Virginia, right? So I was in opposition to it. But then looking back on it and seeing that all these other states got the money, like conservative states with conservative Republican governors like Indiana and whatnot, they got the money. They expanded Medicare. That helped their economy. That also helped hundreds of thousands of working people that couldn't qualify for the Obamacare subsidies and didn't make enough money to pay for care, and yet they had to pay the fine. I mean, the thing was a mess. And then when the Republicans tried to fix Obamacare, right, in Congress, when they had their alternative, whatever it was, the big argument against Medicaid expansion is that, the federal government would stop funding it, it would go away, and then everybody would be stuck with the money on the hook, and it would bankrupt Virginia. But then I went through the Republican in Congress and all of their repeal and replace plans, and every one of it funded Medicaid expansion for the states that did expand into perpetuity. So they all got funded. So it was like, okay, Virginia didn't get the money at the beginning. We didn't cover the people that needed the money, the coverage. And it was all based on the fact that the money was going to go away. But now every Republican plan is to continue the money for the states that took the money and punish the states like us who did not. Now, how does that make any sense for us in Virginia?
Well,
can you explain that to me?
I'm not the one really to defend their plans. We obviously had a lot of concerns with where they were going. I mean, and for the very reasons that you pointed out. I mean, Virginia had not expanded, and so, but we continue to get the cuts. And in fact, one of the things that really is concerning us that We have been pointing this out for the last couple of years, and quite honestly, I don't think people have been taking us very seriously about the fact that, the way the Affordable Care Act was supposed to work was that they were going to reduce the reimbursements for Medicare coming back to providers, and the reductions in the funds coming to the providers was going to be made up by expanding Medicaid, providing access to the currently uninsured and those who right now are not paying. Right now, most hospitals, health systems, about 7% of the patients are free. So you're going to make up the money by reducing the uninsured who are coming in. Well, the problem is that, we now are getting the cuts, and we haven't gotten the upside on reducing the amount of uninsured. And what they were going to do in Washington this year was they were going to, like you said, they were going to leave those states that had expanded Medicaid with their funds coming in for several years going out, and essentially giving the states that didn't expand little to no additional money. And just to give you an idea about what that means is that we are getting these cuts. In fact, this year we can actually point to the fact that it's almost our Medicare shortfall. This is actual shortfall for services provided to Medicare patients, and because of the reductions in Washington, it's over $900 million for hospitals across the state. That's up almost 50% in 1 year. And so you're looking out the long term, this is not going to be sustainable for the hospital health systems to continue to suffer these losses. This is why we're very excited with the new governor, his new approach, with the new General Assembly, and the fact that you look at what happened in Washington, the Affordable Care Act is not going away. Maybe the individual mandate will go away, but the other programs are still going to be there. And now really it's up to the General Assembly, the new governor, to work together, come up with a solution that allows us to draw this money down and to provide access and care to people in the state that need it.
All right, so Sean, let's get back to Medicaid expansion in reality here in Virginia, because I am now in favor of it because it just makes sense. One of the other arguments that Republicans have against it is, okay, the federal government is only going to pick up 90% of the money it takes to pay for putting another, what we estimate might be 400,000 or so people on Medicaid. Now, again, these 400,000 Virginians, these are not welfare recipients, okay? These are working people. They have jobs. They make too much money to qualify for the Obamacare subsidy, all right? But they don't make enough money to buy the insurance at the rates they are now. Plus, they have to pay the fine if they don't buy it. So they're really in a tough situation. All they're trying to do is cover their family. So we got this 400,000. So under the prior negotiation, the VHHA said, okay, here's what we'll do. Your organization, let me see if this is still on the table or debatable. Your organization said, okay, we will give the state the 10% gap between Medicaid expansion than the federal funding. When the 100% funding goes to 90, we will pay that 10% because our hospitals are going to be better off under that plan than under the status quo, which is basically rising costs for indigent care every day. Does that offer still stand?
Well, we are very willing to sit down and have a conversation with the General Assembly and the governor about that. The way the Governor McAuliffe put it in the budget yesterday is something that we don't support. If we do this type of program, and we need to have what we call guardrails to protect and make sure that the money is really used for health care and does not become just another source of funds for the state to potentially use in other areas. And so we are willing to have that conversation because it helps everyone in the state if we end up finding a source of money to make that match. It will end up potentially protecting the state from any downside from the federal government, potentially changing the program in the future. But also for us, it helps us make sure that we reduce our indigent care, reduce our uninsured that are out there, and helps make Virginia the healthiest state in the country. This is one of our goals as an association. And for the healthcare community in the state is finding ways to make people healthier, and that in the long term ends up making and reducing costs across the state. In fact, I do have to point one thing out, John. When we talk a lot about a lot of these issues, like even with all the challenges that we've been facing in healthcare, last year we ended up seeing one of the lowest percentage increases in how much healthcare costs, actual healthcare costs in the country. It was only about 1%, which is below inflation. And it shows you that the healthcare community, the providers, are very serious about reducing their costs and improving quality. Virginia now is in the top 10 in the country, according to the most recent federal standards, for safety. And so we're doing everything we're supposed to be doing, and we're willing to work with the new General Assembly, work with the governor to come up with a way, a fiscally responsible way to help come up with this match and then take advantage of these federal funds, which are there. And everyone needs to understand that because the Affordable Care Act taxes, we're all paying for it. And so we're sending our tax money to places like California and New York and Illinois instead of bringing that money back to Virginia and helping take care of the very people you mentioned. And that's the key point about this is that, these are I'm going to call them working poor. These are people who, like you said, make too much and too little to qualify for any of the existing programs. And so these are people who are in minimum wage jobs, who are working at, various retail and fast food and janitorial or whatever, who are working. And, there's a way to come up with programs that help make sure that this is a step up. This is about personal responsibility, and this is about accountability in the long term, and at the same time helping people who need some help.
All right, so Sean, you're a Republican. You were a Republican on the supervisory board of Prince William County. You were chosen by Bob McDonnell as a transportation secretary. You were in a Republican administration. But most Republicans in Virginia are opposed to Medicaid expansion, like I was, based on what we talked about earlier, that they would be stuck with a bill and the program is inefficient, it's ineffective, they don't control costs very well, so why expand a failing system? That was part of the argument. But the other big part of the argument was that it would eventually lead to the potential of bankrupting Virginia, right? Because if Virginia was on the hook for 400,000 people with Medicaid expansion, if the federal government stopped funding it, then we'd have to have like a 10% tax increase. You couldn't fund it, or you'd have to take it away or something of that nature. But now those arguments, Sean, no longer hold. We saw it in black and white. Republicans controlled both houses and the presidency, and they were not willing to do that. They were not willing to cut it out. So to me, that argument, I don't know how you make that argument now, based on the reality of what happened in the Obamacare repeal and replace debate. So that is just not going to happen. So now you're continuing to just give the money to the other states. We're getting none of it. Our people are not covered. That 400,000. I mean, even as a Republican, how can you argue now in opposition to this? I don't understand. That's why I've changed my mind on it, just based on fact. I mean, facts don't lie. Everybody can have an opinion, but facts don't lie, right?
Well, and that's exactly right. Listen, this is a time to do it. I think the Trump administration has shown their willingness to work with states to come up with programs that are, essentially appropriate for their communities in expanding coverage and dealing with access. And John, I want to come back to, essentially, this is not a partisan comment, but I do need people to think about the fact that, we have this debate as to whether health care is a right or a privilege. And, years ago, Congress passed a law. President Reagan, I think, actually is the one who signed it, that it's called EMTALA, that said any individual who shows up in an emergency room they must be treated regardless of their ability to pay. When they did that 35, 40 years ago, essentially they made healthcare a right. And so people now come into the emergency room with the common cold, with minor cuts and bruises, the most expensive care that's possible. They show up in our emergency rooms. The issue is that for too long, I'm going to say that, the political structure has essentially passed on the costs of health care more and more onto the providers, who in turn have to pass those costs on to the commercially insured like yourself or myself. So what I'm trying to point out to you is that when you look at the fact that if you're a Medicare patient, you're somebody who's getting Medicare, right now you walk in, get $1 worth of service from a hospital, we only get 88 cents back from the government. If you go in as a Medicaid patient, somebody from Virginia goes in to a hospital, gets care, we only get back 71 cents on the dollar. And then on top of it, you got another 7 cents. 7% of the patients coming in are completely 100% free. Why is that all important? We have to pass the costs on to the commercially insured. That's why, in one way, you see higher costs for commercial insurance. Mm-hmm. And this is a hidden tax. Anyone who wants to, who thinks about it and realizes that the government is essentially, every time they cut reimbursements to the healthcare providers, that forces the healthcare providers to find ways to pass those costs on to those who are able to pay. That is a hidden tax, and no Republican should support that. The Republicans should be trying to find ways to deal with this reimbursement issue and find ways to get the uninsured insured so that they are not showing up at the emergency rooms and instead come in for a wellness checkup once or twice a year like most other individuals do.
I mean, Sean Connaughton, that makes such perfect sense. Sean Connaughton, the president and CEO of the Virginia Hospital and Healthcare Association. For more information, it's real easy. Go to VHHA.com, VHHA.com. And, Sean, look, we look forward to a very spirited and vigorous debate, this General Assembly, Medicaid expansion back in Terry McAuliffe's bill. I think it's going to pass the House. They've already got, 49 votes. They're going to get Glenn Davis, that's 50. They're likely to get 51. The governor is going to be able to sign it. If they can get one state senator, it's going to pass because, no. Justin Fairfax can't break the tie, I think, because it's a tax-related issue. So they're going to need, I guess, 2 Republicans to flip on them. They'll probably get Hager. They'll need one more. Anyway, either way, it's going to be close. Sean Connaughton, we're out of time. I want to thank you for being with us today. Sean Connaughton, again, the president and CEO of the Virginia Hospital and Healthcare Association. Sean, Merry Christmas to you, your wife, and your family. Thanks for being with us, sir.